Well, according to the CDC, 1 in 3 adults don't get the recommended 7 hours of sleep, which can lead to other health problems.
Hear, hear. Kansas City University Assistant Professor of Primary Care, Dr. Benjamin Grin, joins us this morning to discuss the importance of sleep health. Good morning, Dr. Grin.
Good morning. Thank you so much for having me.
We appreciate you being here. Just the mention of sleep makes me tired. But a lot of people associate being successful with being very busy, but that is very concerning from a medical perspective, right?
You know, it's absolutely concerning. I think the hard thing is that a lot of us assume that when life gets busy, we can overcome our need for sleep.
Yes.
But the reality is it's a basic biologic need, just like the need for food or water.
Yeah. So what's the average optimum amount of sleep that an adult should get?
You know, there isn't a magic number. Most sleep experts recommend that American adults get somewhere between 7 and 9 hours of sleep a night, but it really depends on the individual.
Okay.
Because I've heard there are some people who can truly do okay with less than that.
I think it's absolutely true. You know, and the reality is when my patients ask me, hey, doc, am I sleeping enough? You know, how much sleep should I be getting? I ask them how much they're sleeping a night, but I also ask them, you know, how do you feel in the morning? Do you feel well rested? Do you feel alert? Because really it's not just the quantity of sleep, but it's also the quality of sleep that matters.
That's a good point. So how do you define sleep deprivation, and when is it considered chronic?
So sleep deprivation basically means your body is not getting enough sleep to optimally function. And sleep deprivation becomes chronic when that's not just occurring for days, but more weeks or months. And you know, the problem with chronic sleep deprivation is it's basically becoming a new normal for folks, and they don't even realize that they're sleep deprived.
What are some of those
effects?
Yeah.
But how can it
How do
affect
we know?
It can affect really every system in your body. So, you know, when you think about your brain, it can affect your mood, your memory, your reaction time. It can affect your immune system, so you can be more likely to get sick when you're sleep deprived. It can affect your heart, put you at risk for high blood pressure, diabetes, heart disease. It can even decrease your life expectancy if you're chronically sleep deprived.
That's serious
Yeah,
right there.
don't love to hear that.
What do you recommend to people who say, hey, I'm probably not getting enough sleep? What do you recommend?
Career change.
Maybe that, don't go into medicine.
Or television.
First of all, know that you're not alone. You know, challenges with sleep are common, and some of them are fixable, you know, without a career change.
Sure.
A couple of things I recommend to my patients. First, whenever possible, try to go to bed at the same time every night and wake up in the morning at the same time, even on weekends. I know it's not always possible for people. Also, you know, good sleep hygiene is really important, and that means, you know, no bright lights an hour before bed. You know, put away those iPads, iPhones, tablets. All that blue light can make it really hard to sleep. The last thing, it comes up a lot in clinic, you know, if you wake up in the middle of the night, you can lay in bed for 20, 30 minutes, try to get back to sleep. But if you're really not able to sleep, it's okay to get out of bed, go to a quiet room, read something. A lot of times the anxiety of not being able to sleep for people actually makes things worse. And so don't lie in bed for 2 or 3 hours and fret about the fact that you're not sleeping.
Yeah, that's the worst.
It is. What about getting sleep in shifts? Meaning, you know, you might sleep 4 to 5 hours overnight, and then you might take a nap during the day, which may last, you know, an hour or two. But in that second, you say like you're getting REM sleep, you're dreaming, you know, you're talking in your sleep. So, I mean...
It's a very hypothetical question. Just let's say.
What do you say to that?
If it works for you, I think it's okay. I love naps as much as anyone. It can become a problem for some people, you know, when you're napping long periods during the day and then you're not able to sleep at night and you're not feeling well rested in the morning.
Yeah.
But I think an occasional nap, if it feels good to you and you're feeling well rested in the morning or whenever
and you don't
wake
have
up,
any problems getting to sleep at night.
Sure.
right, and also you don't have any problems getting to sleep at night. So
Okay.
all things in moderation, I guess.
Okay.
All right. Dr. Grin, thank you so much. We appreciate it. It's a good reminder for those of us who are chronically sleep deprived.
That's right.
And trying our very best.
I
So we
can't wait to
appreciate it.
celebrate my nap today. It's going to be great.
Yeah, same. That's my favorite part of the day. All right, coming up.
Thanks, Doctor. Good to see you.
Thanks for having me.